And welcome everybody for joining us today on an HVO discussion related to professional burnout. And on our call today, we have 3 HVO volunteers and members of our leadership that are going to give you insights into their individual experiences and thoughts around their individual burnout experiences and lessons that they've learned and ways that they've come up with that have helped them feel re-energized professionally. So we have Rick Henker on the call, who is a nurse anesthetist and on faculty at the University of Pittsburgh and a practicing anesthetist at UPMC Presbyterian Hospital. And he developed the HVO curriculum and training programs for nurse anesthetists in Cambodia and Laos. And he's also worked with our project in Bhutan. He has been on the HVO Nurse Anesthesia Steering Committee, and he is a member of the HVO Board of Directors. Megan Mitchell is a physical therapist who works in Colorado and serves as HVO Project Director for our site in St. Lucia, where she's also been a volunteer. And then we have Divya Singh, who is an orthopedic surgeon in Seattle, and she has volunteered in Malawi, Myanmar, and South Africa with HVO. And she is the project director of our orthopedic project in Myanmar and now is the chair of our orthopedic steering committee. So before the pandemic, there was already frequent news reports about healthcare provider burnout, and the topic has been addressed in webinars and talks at a lot of association meetings that us as staff, and I'm sure you as health professionals, have attended. And now, of course, it seems there are even more frequent, almost daily reports of burnout that physicians, nurses, physical therapists, all types of health professionals are feeling stressed and overwhelmed. And that may be leading them down alternative career paths or taking long-term breaks or seeking solutions to help them feel re-energized and re-engaged professionally. In conversations over the years, many HVO volunteers have mentioned that they're volunteering with HVO or other local organizations they may be involved with, or other personal habits and practices have been an important antidote to their burnout. So every person's story is unique, but we're hoping that on the call today that there might be lessons that you guys have learned or perspectives that you have that could be relevant and valuable to share with our community at large. So with that, I'm going to hand it over to you guys. And I think as a starting point, I'd love to hear from each of you on when you hear professional burnout, what does that bring to mind for you? Or how do you think of that commonly used phrase in your experience, and how have you personally experienced burnout in each of your respective professions? So why don't we just go around, and let's start with you, Rick.
Thank you so much, April, for the introduction. So as I think of burnout, I think of the fact that, it's mentally, physically, and emotionally, I've been drained due to either things such as short staffing or things not going well with patients or those types of things. And what I found is that some of the places that I've worked with has really helped with avoiding that burnout or feeling better about my practice is some of the things that have been mentioned in the literature and that I've experienced is just the team support. So the places that I work at, such as UPMC Presbyterian, even though at times we're a little shorthanded, the administration's always asking for extra staff, and the people I work with are excellent team members and provide that support. I found that also with some of the work that I've done with HVO, particularly when I've gone to a place like Bhutan or Lao Friends Hospital for Children. The teams that I work with, the team of HVO volunteers in Bhutan, it's always great because we get together and talk about things and provide that support. So we feel like we're working together on issues. And also Lao Friends Hospital for Children, even though I may be the only HVO volunteer, there's other expats that are working there. And we'll get together and provide support. And the Lau Friends Hospital for Children nurse anesthetist, also excellent support to work with. So I found that, you know, if I'm feeling like a little bit stressed, and I found that the teamwork always very helpful in terms of dealing with some of the issues related to burnout.
Great. Thanks, Rick. Yeah, that's really a helpful insight. I mean, it's really clear from all of us, you know, you're not doing this alone. So having a team behind you and having your friends and your colleagues to be able to support you and um, troubleshoot together is key, I think. And it's no doubt you've found that also very clearly in Cambodia and Laos and Bhutan over the years. I know a lot of those guys become dear friends for you. Okay, so now let's move to Megan.
Thank you for that introduction as well. When I think of burnout, I don't actually think of the end of a career. I think of professional exhaustion. And for me, it tends to be more related to the system that I work in within the United States. Fighting the system for recognition, fighting the system for understanding, for professional identity. Something as simple as being differentiated from occupational therapy, which is a totally different profession and skill set. I think for me, pre-pandemic, the exhaustion started to show up as an apathy and a general feeling of being disengaged when I showed up to work. Not fighting as hard to advocate for my patients, and if they were okay not working with me, then that was just fine. And gradually that turned into more fatigue. And with the onset of the pandemic, all of that just heightened. Everything like got exponentially worse. So my fatigue was exhaustion, my frustration was now anger, and I was getting angry at my coworkers who were just as stressed, and we were just as under-recognized within our hospital system, and we were fighting to be allowed to do our professional scope of practice. And not to say that that's going to be a quick change or an easy change, but for me, volunteering in particular was an avenue for taking this very large scope and skill set and applying it in a different area. So if I couldn't apply everything I had in the acute care hospital, then I could certainly work and apply it in an outpatient setting or in a sports population setting. And what I in particular did was found a different area of practice that is done internationally. So part of our disaster response and disaster management. And I took that and I started to push into that area within my hospital system. So I was able to kind of hone some of that anger and frustration and really kind of put myself into the decision making that was happening so that I could advocate not only for myself, but find something new to re-energize the skills that I already had into the space that we should be in already. In addition, working with HVO allowed me to professionally challenge the things that I knew in school and hadn't used necessarily for a while, and remind myself why I actually went to school to be a physical therapist and apply it in a totally different setting with a different patient population, and find the joy that I had when I first applied to school. So for me, the volunteering piece was a reminder of my purpose. And so I did a lot of that through the past year.
Wonderful. Thank you, Megan. That was great. You touched on a lot of things there that I think are important. I mean, first, a lot of the ways you experience burnout, I think, are the words you common hear people say, that they just felt apathetic, they felt tired, they felt fatigued, that they were up against a battle or a system that they either didn't know how to fight, or they just felt like they couldn't make a difference, right? And that'd be exhausting for anybody. But it is encouraging to hear that you eventually got to a point where you realize that you can't change the system overnight. So how do I channel this frustration and this, built up energy around this into something productive. And I think that's where everybody should hope to maybe find themselves one day when they are able to channel that into something productive. So I think that's wonderful. And we have heard from many of our volunteers too, as you said, that for them, a lot of the experience with HVO has brought them back to basics, as you said, has reminded them of some of the reasons that they went into the profession, that not that those experiences don't exist in their home work environment, but sometimes I think just the water gets muddied and it gets cloudy, and you're in this system that you may feel like you're drowning, as you said, and so it may just be harder to see those experiences. And so, getting out into the world and experiencing it in a different way can remind you of those. So I thank you. That was wonderful. Okay, so then now let's jump to you, Divya.
So once again, thank you for organizing this, April. And I would echo a lot of what has already been said by Megan and Richard. I had been practicing in Seattle for about 15 years, and I had made various changes in my career. First, I was in private practice, then I was in an HMO, then I joined a multi-specialty group. And I was looking for the ideal practice. And unfortunately, I don't know that that exists right now with the state of medicine. And I was getting increasingly frustrated with all my non-patient care related activities. There was more and more time charting and dictating and coding and billing and jumping through all the administrative hoops that are required in our job right now. And the more you would try to push back, the more would be loaded onto your plate. And the emphasis was really in every practice setting, see more patients, do more procedures, be better, faster, more efficient. And what that meant was I spent less and less time actually seeing and taking care of patients, and more time doing a lot of other things. And I felt, like Megan was saying, emotionally exhausted, professionally exhausted, and certainly physically exhausted. And that sense that I'm an orthopedic surgeon. I'm used to working hard. I'm used to staying up all night and, doing a lot physically, but this was a different level because I was doing things that were not meaningful or satisfying and had nothing to do with really patient care. And I found that super frustrating. And echoing that point again of I couldn't change the system. And I tried, we all try. But I was becoming increasingly just unhappy. And I didn't want patient care to suffer, but what was suffering was my own sort of interest and lack of joy. And I was sort of phoning it in. I would go to work, but I wasn't excited about the 30 patients I was going to see in clinic. And I didn't want it to affect patient care. Because I think that is part of burnout, that sort of depersonalization, a little bit of apathy. And that's not how I wanted to be a physician. So I actually quit practicing about 5 years ago. I quit my full-time practice, and I didn't know what was going to happen. But, fortunately for me, I sort of planned ahead. I didn't have a lot of debt or anything like that. So I could take some time to really kind of think about what I wanted to do for the next steps of my career. And what I needed really was just time, going back to what is the purpose of my life? Why do I do what I do? And I was reminded, as Megan said, that the reason I went into medicine was to take care of people, who didn't have the resources that they would need to be healthy. So one of the first things I did when I quit was I spent some time, I went to Malawi for a few weeks to work there. And then I went back to Myanmar where I'd been before and worked there. And again, it was just a process of what is the essence of what it is that I want from my life and from my job. And so my HVO experiences and my volunteering overseas was really very key to sort of deciding what my practice was gonna become. And so we can talk about what I do now currently in a little bit later, but that was just sort of the beginning of what I felt as threatening to me as burnout. And we had talked a little bit about what that term is, and it's so fraught and means a lot of different things for people. But I definitely was not happy, and I was exhausted with my job.
Mm-hmm. Great, thank you, Divya. Yeah, it sounds like you guys all experienced this in very similar ways. And you took the route of just realizing you needed time and taking that time and coming back. It sounds like at a different place and with a different energy level and a different perspective. And I think that makes me interested in hearing from one or all of you on this idea of whether, you don't just experience burnout and fix it necessarily. So, considering this as whether it's more of an episodic thing that you may come in and out of at different points in your career, or that you felt like you came to a place where you recognize the signs and you have tools in place, and that now you don't necessarily experience it anymore, if that makes sense.
I don't want to speak for everyone, but sometimes women we're not always the best at setting boundaries. I remember my last anyone identify? I remember at my last practice, day one, I was told by the CEO of the hospital, always say yes, right? That was the assumption. Anyone asks you for something, the answer is always yes. And that's just not necessarily, it's a good way to keep your practice busy and to keep yourself busy. But it's not always the best care. And sometimes you have to say, no, I'm not on call. I'm going to go home. And I think really sort of realizing what's meaningful to you, whether it's time with your family, time with your friends, if there's a passion that you need to pursue, whatever that might be, and to give yourself space to be there for that, rather than just your job. And that took me a long time to sort of figure out. And now, I'm working again clinically. I work for the Indian Health Service part-time, and we can discuss that later. But as I'm looking for different jobs, I'm pretty clear about what I want and what I don't want. And I put it out on the table. And if that's not going to work, then we all move on. And it's better to know that up front than to get into a practice where you're like, yeah, I'll take call every night, and no, I can work all the holidays and whatever, and then just be unhappy. And that's on me. So I think that's kind of important too. And it took me some time to figure that out of why am I so grumpy all the time? Well, because you haven't, had a vacation in a while, or, whatever it is. So that's one little tip that I would recommend.
Thanks, Divya. Yeah, that's really helpful, right? And like you said, you didn't come to that place overnight, right? It's really easy for people to say that, oh, just don't say yes to everything, but it takes a level of just knowing who you are, and like you said, comfort with who you are, and knowing what you want out of life, and just that confidence to make those decisions for yourself, which I would imagine can be a little more challenging earlier in your career. Versus later in your career when you're trying to establish yourself professionally. But I think that's really good advice for anybody in any facet of life to take.
I like some of the comments that Divya made about always saying yes. And I find that what I've had to do is I made the big leap a couple of years ago and said, no, I really want to go to an 8-month appointment for my academic appointment, because not only do I work in the hospital, but I also I'm a professor at the University of Pittsburgh. And what I found is that my time just gets eaten away, and it will be taken up with things that everybody wants me to do. And I found that I have to set boundaries. And I said, no, 8-month appointment, and that's it. And then Pitt now comes to me with contracts, and it's almost kind of funny for this summer. They're like, well, no, we'd really like you to work 65% instead of the 30%. And it's like, okay. And they keep saying, but you'll only do this. And I find that that's so common with many of the groups that I work with. They're like, no, could you just do this? And I found that, no, I've gotten better over time saying, no, and I have been giving up lectures and saying, no, there are other people I can do these lectures. There's other people I can do this, and trying to go ahead and transition and give people that I think are earlier in their career that maybe should be doing some of these things, and just suggesting and being more of a mentor at this point. you know, one other point you mentioned about the transient nature of this burnout. And what I found is that, yeah, I'll go through ups and downs frequently with this. And I found, um, you know, it seems like the perfect storm with some things. I remember one of the really low points that I had, it seemed like it was January, and I'd had a patient that really did poorly in the OR at Presby, and the weather's depressing and it's cloudy all the time. And it's like, oh, and it was just hard to get up and go to work. And I found you have to figure out what works for you in terms of you know, the resilience, the emotional intelligence, and you know, some of the things that work, such as exercise or mindfulness. And I found that it's like, yeah, these things are all important. And too often, what I don't like is that burnout is viewed sometimes as weakness, and it's like, not at all. I think what we're doing is all of us go through many of these ups and downs. One of the people that I work with at Presby, um, you know, often joking around and makes a lot of comments that I find are interesting. And we were actually talking to him, and he actually got quite serious at one point. And he said, you know, I've really been having a tough time lately because I've had many of these 30-year-olds that we've been doing surgery on that have had glioblastomas. And I'm like, oh. And he said, I'm just really struggling these days. And I never would have thought that this practitioner would have had these ups and downs in terms of his career. And he admitted that he was having some burnout. And I think many of us do go through this. And it's just a matter of trying to figure out, you know, what are the support mechanisms and what can we do to move forward. I feel like, to me, again, getting back, a huge piece is you know, my time with going overseas is just such a nice change and a great way to deal with it, because all of a sudden I've got a nice change. And I can't remember if Megan or Divya mentioned it, but all of a sudden I feel much more altruistic. And instead of feeling like I'm working on helping an organization make money, instead I feel like I'm back to the reason that I went into the profession, and that is the altruism in terms of going ahead and taking care of patients and seeing them, you know, going ahead and take care of them and seeing them recover from surgery and looking at their post-op pain and treating it and just really, really enjoying that. And then it brings me back up to realizing this is the reason that I did this. So, and I think all of us have kind of mentioned that to some degree, and that's a very important piece. So I think HVO, the opportunities, brings us that ability to jump in and with these opportunities and realize, oh, this is the reason that I got into the area of practice at the beginning, and it helps you see that.
Thanks, Rick. Yeah, I mean, I think you made one important point early on, you know, just before we move on to HVO, that burnout may not look the same on everybody, right? Like you said, that colleague of yours, you never would have guessed, right? So maybe just based on their personality or how they carry themselves or their age, you just, I think sounds like it's something that everybody at some level will experience at some point in their career, most likely. So I think since you segued nicely into HVO, and you guys have all touched on it a little bit, but I think it'd be nice to also hear from Megan and Divya how your experiences with HVO have specifically re-energized you. If there is a story or an instance that comes to mind, that's great. Or if it's just more the general themes that you guys keep coming back to that Rick mentioned, that it just, it brought you closer to the patients again and reminded you of why you went into your profession in the first place. And then also, if you guys have any thoughts, you know, HVO is focused on the education and the teaching. So while you are working with the patients, I'm curious if, you know, working with professionals overseas and kind of helping train and mentor them, if that specifically also kind of helped change your perspective and helped you feel re-energized professionally?
So I am swimming in student debt. Okay, there's no way around that one. I'm swimming in it right now. So I am working full time. I am trying to pay off my student loans. And for me, I've always wanted to work internationally in some capacity. I hadn't ever heard of HVO until it came across my LinkedIn feed, and I clicked on it and started looking through the options. And at that point in my career, there weren't a lot of international organizations that were specifically recruiting or looking to have an option for physical therapists. So for me, it was like the unicorn. They had something that was specific for me to volunteer with. And I immediately jumped at the chance and then looked at my PTO bank to see if I could take the time off. So I kind of stumbled into St. Lucia in particular because it fit with what I could do in that moment. But I had been to St. Lucia before, so it was also a very comforting transition for me. So I had visited as a guest to the island, and then I was like, I am absolutely willing to go back. So I did, and I could not have had a better experience. So the clinic that I was at was unfortunately understaffed at the time, with at least 2/3 of the therapy staff out for medical leave. So it wasn't as much teaching, which I do love to do, and I do help out with the CUPT program. So it was a lot of practice, and I could just provide good patient care. There was no billing needs. There was no system issues. We could just have your patient who came in, ask for help for this problem, and then I could help them with it. And it was very clean, and I really liked that part of it. And we go in with an idea for an education topic that we're going to present to them. And what I gained was actually a better understanding of their healthcare system, which I thought was more impactful for me than what I had brought to them, talking about differential diagnosis within the scope of physical therapy. So it was a two-way learning for us, and I felt very energized by that. I forgot the second part of your question, but that was
that was perfect. I think, yeah, exactly. Just talking about how your specific interactions, yeah, and they are unique to all of our sites. And St. Lucia is one of the ones where there is somewhat unique, and it's a little more clinical practice than education. But it sounds like you had to do a little bit of both, which is wonderful. And I'm glad to hear that you left feeling re-energized.
We often learn more from our sites than we teach. And one of the things my work overseas has really taught me is the pathology that you don't see in America, a lot of which is delayed, misdiagnosed, missed. And it really it makes you better at your game, right? To be able to go back to the basics and how do I take care of this? Or and going back to the teaching, how do I help these people take care of this? A problem that I've never seen, maybe I've read about. But you really do have to get better and stronger and use all the things that you've learned in your professional career. And so I found that very exciting. And my first mission was not through HVO, but it was a sort of fly in, fly out mission to Rwanda. And I learned a lot just about how you provide medical care in a resource poor setting, but the importance also of providing follow-up care and leaving something more than just the surgeries you did, which is why I transitioned to going to places through HVO or orthopedics overseas, because I found it much more satisfying to me to be able to train the local providers. And each of the programs that I've been through have been very different with who I'm working with. My first program in South Africa was sort of a self-contained, old-fashioned medical compound where the surgeons and the staff all lived in the hospital compound. And it became, going back to Richard's point, very much of a team you'd work together, you'd come home, you had happy hour and had dinner together, and then you'd go back the next day. So you built these relationships with people. And then you would have students, whether it was medical students or residents, and just, talking to them and realizing how much you know that you didn't know you knew. Because we just take it for granted. This is what I do. Of course, everyone knows this. And then realize, no, at some point I was the student and had zero knowledge. So just the basics of anatomy and patient exams and, how you put a splint on, how you give a digital block, these just really simple things had real impact. And that was the same in Malawi, where I wasn't working with physicians. I was working with clinical officers who basically had just gone through college and had very little knowledge about orthopedics and certainly not much about surgery, and trying to give them some basic skills. And then April, to your point, so the third place and the place I've gone most often is Myanmar. And it's a very sophisticated hospital system. It's, the tertiary care trauma center in Yangon. And you train medical students, you train residents, you train fellows. And I have seen the progress of the person I started with as a resident, then becoming a fellow, and now becoming an attending. And that's something. It's fun to see that. And, one of my favorite residents ended up being a hand surgeon. So I'd like to think I had something to do with that. And for me also, when I started, there were no female residents. And over the course of time, there's become more. And I think some of it is, if you can see another physician who looks like you, that will encourage you to sort of consider that as a profession for yourself. And so that was meaningful to me as well.
I think one of the points that I think both of you made that I like is that I found that when I go overseas, I just learn an incredible amount. And, I always feel like, yeah, my goal is to go over there and teach. But what I find is I don't know as much about, say, beriberi as, even the nurse anesthetist that I teach over there. They're like, oh, Rick, yeah, here's what happens with this. And I'll never forget one of my early trips. There was a volunteer there, and he was working with the Lao doctors, and they had a child come in, and the mom, and the child was 3 months old, had a respiratory infection. And the volunteer asked the Lao doc, so ask the mom if she's having paresthesias in her lower extremities. And I'm like, why was he asking? And she said, yes. And I'm like, wow. And he's like, oh yeah, this must be beriberi. And I was just shocked. And I'm like, wow. But you get to know the different disease processes, and we're not as expert in some of those disease processes as they are. So what I found is that I learn a great deal, and they teach me a lot. And I think Megan mentioned that she probably learns more than she is taught. And I've found that also, that, I just enjoy the exchange of ideas. And I think they really respect you if you not only teach them, but if you learn from them. And it's very helpful, and it always makes me feel much better in terms of, here I am, I'm learning a great deal also. I've just found, in terms of getting back to burnout, when I'm over at a place like Luan Prabang at Lao Friends Hospital for Children, I look at their healthcare system, and I come back to the United States. And actually, I come back to the United States and think, oh man, I get so frustrated with the healthcare system, and thinking, wow, we're just so inefficient with care. We're not very good with providing. I look at the resources they have at LFHC and how excellent care they can provide given the resources. And then in the United States, we're so wasteful, and sometimes I don't think we're very good at providing as efficient the care. We provide great care, but it's for thousands and thousands and thousands of dollars. But anyway, getting back, I find that, when I go to Laos, it really helps me in terms of feeling much better about, what I do, and takes away any shred of burnout. And then I come back to the United States, and it's like, okay, let's try to be positive about the healthcare system back here.
Thanks, Rick and Megan and Divya. I think it's interesting to see a lot of the same themes coming out, right? About how you're going to teach and you come back feeling that you've learned more, and just that time to kind of recalibrate when you're in a different environment and teaching and treating patients. I think jumping on something that Rick kind of just rounded out with, I think it is important to note that I don't think it's not the idea that or the reality that the environments where you guys are volunteering with HVO don't have their own system-wide challenges, right? And their own limitations within the bureaucracy that is healthcare all over the world, and being in a resource poor setting. So, you know, Rick touched on it, but one thought just to open up for maybe a last point of discussion is, you know, I don't think burnout is unique to the West or to the US, and the environments where we do work. I know that there are similar or different challenges that those providers are facing. And we've heard from our volunteers that a lot of times, I think related to what Rick was saying, observing and engaging with those providers as they try to troubleshoot, and that they come up with creative solutions where they can to solve those problems and to provide for their patients, can be another component of what may help remedy some of that burnout, and coming back into their home institution and their home system, like you guys are saying, re-energize professionally for your day-to-day care with your patients and your colleagues, but also to problem solve, to think creatively, and pull out tools in the toolbox that maybe you didn't even know you had, and that can kind of change your perspective upon returning home. So I'm wondering if that's anything that you guys have thought on or experienced.
One of the things that I found that was just an amazing thing in terms of bringing skills back is I do a lot of simulation teaching at the University of Pittsburgh, and we use these very high-tech mannequins, SimMan, and we write these scenarios. And I'll never forget, I was, you know, I've had students go with me to the Henker hospital site, and we went out to the satellite hospital, and I happened to be there, and just to be with this student while she was spending some time in the clinical setting. And the person who was the hospital director at the time came up to me and said, do you know, you're an educator? And I said, yeah. And she said, we're doing these case study things. And she said, could you help write up the evaluation? And I do that all the time in my job. And I said, sure. And the next day I was involved, or not, maybe a week later I was involved in, and they were doing simulation education at this satellite hospital in one of the poorest districts in Cambodia. And, you know, I remember going to Bill Houseworth, who is the executive director at Henker Hospital for Children, and telling Bill, you need to buy these mannequins so we can do simulation education. And then I went to the satellite hospital, and they're showing me how to do simulation education, you know, on a shoestring budget with scarce resources, and they were doing it effectively. So it changed the way that I was able to look at doing simulation education when I came back to the United States and realized it's not the technology, it's the way that you teach. And they showed me how to use resources for teaching incredibly well. And it led to us actually developing and we did more simulation at this satellite hospital. And I've kept in touch with the satellite hospital director, Helen Canton. But then we went ahead and we did a whole series of simulation education sessions, days actually, at Henker Hospital for Children. And we were so good at using, you know, the resources that they had, the mannequins, and we didn't buy the $25,000 mannequin. Instead, we were able to use the less expensive mannequins, and we were able to do it. And it really taught me some things as I came back to the United States in terms of how helping me learn how to teach. And always amazing the things that I still, part of the reason I love to go, again, this kind of hits home on that point again, all the things that I learn when I go overseas.
Great. Thank you, Rick. Yeah, I think we're getting back again to, the things that you guys learned so much. And, just to probably round the conversation out and bring it back to the topic of burnout. And I think what you guys are all saying is the idea that the more that you're learning and growing from these colleagues that you're interacting with, that is part of one of your solutions you found for you guys, that you've integrated within your professional lives to kind of keep you centered, keep you excited, motivated. So kind of in that vein, just curious if you guys have any additional thoughts or advice or tips that you would give to other providers. I would assume anyone that's going to watch this is either have done some global health work or they're thinking about it. Do I create the space for this, right? Do I create the time and the space to do this? So any additional thoughts that you guys have just that might relate to your tools for dealing with burnout and your experiences that you've talked about today?
So I touched on it briefly, but going back to what was my purpose of becoming a doctor or a surgeon, or what did I see myself doing? And I think for me, the core of it was serving underserved communities, serving underserved people, and certainly the global need is so great, but the pandemic kind of shut that down pretty definitively in terms of us being able to go anywhere. So, and April and HVO have been working on, various virtual learning platforms, virtual journal clubs, virtual lectures, all these things. But I would also postulate that there's great need in our own country here. And I've been fortunate for the last 2 years that I work part-time at the Navajo Nation, which in many ways is similar to the resource settings I've worked in overseas. But it goes back to serving a community that's underserved. And I think anyone who, for me, certainly that sense of purpose and service is so important to keep me still passionate about medicine. And so I do encourage people to do any kind of volunteerism that they can, whether it's overseas or whether it's domestic, and really do, take the time to think about what's important to you in your life. That it's kind of cliche, the purpose-driven life, but I think certainly the pandemic has brought that home to us of what's really important, what's important in our day-to-day lives and in the big picture. So.
Great. Well, thank you guys so much. I think it was wonderful to have 3 different professions and people that have worked with HVO in different geographies and at different stages of your careers, just to offer your personal experience with burnout and kind of the journey that you've been on with that. And of course, as a longtime HVO staffer, I'm thrilled that HVO has been a tool for you guys and a means with which you've been able to sort of merge, right, giving back to the larger global community, but also feeling like you're bringing stuff home that you're learning professionally, but also that personal growth and job satisfaction. And so I think that's wonderful. And I thank you guys all so much for your time and your willingness to share on this topic with our community. So thank you.